Hey everyone, Dr. David Clark here. Today I'm going to walk you through another real patient case study from my office. This is a 35-year-old woman with known Hashimoto's, but still having fatigue, brain fog, and chronic pain. So if you are suffering with those symptoms or you know someone who is, I think you're going to find today's case very helpful. So let's get into it. All right, if we take a little bit further dive into her chief complaint, she has fatigue. Now, this is a fatigue, as I'll point out to you, that is kind of indicative of a certain type of problem with her hypothalamus, pituitary, adrenal axis. Now, don't immediately think, oh, adrenal fatigue, because as I've said many times, adrenal fatigue is just not, it's just not a real thing the way most people have it defined. But what she does have a problem with, I'll go ahead and tell you, is a problem with her HPA axis, and we'll get into that more in just a minute. Now, she also has brain fogginess. Now, for her, what that means is she thinks kind of slowly, she can't focus, she has a really hard time writing. She's kind of been a creative writer and had some academic writing, and she's really had problems with that for the last couple of years. And for her, that's what her brain fog is. So anytime someone says, I have brain fog, I always have to ask, well, what do you mean by that, right? Well, for this particular patient, it's slow thinking, hard to focus, and a really difficult time writing. Now, she also has some anxiety that she's had for years and years and years that may not have anything to do with these other things. She also has chronic pain, meaning she has pain chronically, meaning she's had it for a long time. She's had it in a lot of different parts of her body, and she experiences it pretty much daily. And she has digestive discomfort. And really what that means is she kind of alternates sort of between constipation and diarrhea, has a lot of significant bloating. Okay, so with that in mind, let's take a look at her health history. So about age 8, she was diagnosed with scoliosis, and ultimately she had what's called a Harrington rod surgery, which is a very invasive surgery, but for people that have an unstable scoliosis, that's what you got to do. Now, is there a known association between that and, for example, Hashimoto's? Not that I'm aware of, not that anyone's ever looked at, but I will tell you that an unstable scoliosis also seems to implicate some dysfunction in a part of the brain called the vestibulospinal tracts, the cerebellum, but those may not have anything to do with these other complaints. For about 11 years, between 2000 and 2018, she had chronic stomach pain, chronic abdominal pain. She had a couple of bouts of gastritis, which means stomach inflammation. Now, when you're me and you see that kind of stuff, you start thinking that could be an infection with Helicobacter pylori. She could have stomach autoimmunity, but you just shouldn't have many bouts of gastritis. Something is going on there. Now, she had nausea in 2021, just a couple of years ago, that was severe and constant. That seems to have eased, but it still flares. Now, I will tell you that when I see those kind of symptoms, my first thought is this person either has an H. pylori infection that's still going, they might have stomach autoimmunity, or they could have something going on in their brain stem, because the part of the brain that fires when you experience nausea is in your brain stem. It's called the NTS. And 2011, back up a little bit, she had recurring skin rash in her lower back and some other places. She prescribed valcyclovir, which is basically for herpes, and she takes that daily. Now, in 2016, she was diagnosed with Hashimoto's based on high thyroglobulin antibodies. And I just want to say a note about that. You have to make sure that when you're getting tested for Hashimoto's, that you get checked for both thyroid peroxidase antibodies, or TPO antibodies, and thyroglobulin. I don't know why, but some doctors just don't do the thyroglobulin antibodies as if you might not have them. The only way to know if you have them is to check them. Now, her TPO antibodies were negative, but her thyroglobulin antibodies were high, so you always got to get both checked. And she was having some hyperthyroid symptoms, which tells you that her Hashimoto's was not very controlled. Hashimoto's can vacillate between hypo symptoms and hyper, and she was having some hyper symptoms. And she was prescribed Synthroid, which again, that's the standard sort of endocrinological treatment for Hashimoto's, is if your TSH is high and your T4 or T3 is low and you've got the antibodies, you're getting Synthroid. They're not really going to do anything for the actual autoimmune side of things. And that's a real deficit, I believe, and have for years. That's a deficit in how medical endocrinology approaches Hashimoto's, and it leaves a lot of people and a lot of women in an area where their TSH is normal, their T4 or T3 is normal, they're taking the medication, but they still feel bad. They still have a variety of symptoms. And unfortunately, usually they're told, well, you're just depressed, or that can't have anything to do with your thyroid or your Hashimoto's. And usually that's just not correct. So in 2018, she had a musculoskeletal injury to the intercostal muscles in her ribs. Also was experiencing at that time recurring hip joint pain, shoulder pain, and foot pain. Now, in the fall of 2022, not too long ago, she was diagnosed with what's called papillary thyroid cancer, which is associated with Hashimoto's, and she had a left thyroid lobectomy. They cut the left lobe of her thyroid gland out because that's where the cancer was and it was contained, and they took it out. Now, recent blood work showed that she needed to have her thyroid medication, her Synthroid, increased to make her euthyroid, and that is being handled by her endocrinologist. And I do not think that the thyroid cancer has returned because they're monitoring her for that. And that's really, really important in this case, that someone, not me, because I don't deal with that someone is monitoring her for that possibility. All right, her family history was significant for her mom who had early osteoporosis. Now, when I see this, and I know that this patient has Hashimoto's and her mom had early osteoporosis, my mind goes to the fact that I wonder if her mom has Hashimoto's or if her mom has an autoimmune cause for her osteoporosis, because that is possible. Her father, hypertensive and hypercholesterolemia, grandparents, lymphoma, melanoma. Well, that's, that gives me on the cancer thing, but she has papillary thyroid cancer. She has a sister with anxiety, gallstones, and kidney stones, a brother with inflammatory bowel disease, which is most likely going to be something like ulcerative colitis or IBS or Crohn's, all of which are autoimmune. And apparently there's some history of essential tremor in the family, which I'm not going to get into too much. She does note bruising easily. Now, bruising easily can happen if your iron is low, if your vitamin C is really bad, if you have platelets that are low for a variety of reasons. And so that makes us really interested to know, because she's 35, she really shouldn't have the old person easy bruising thing, and she's not diabetic, she's not taking blood thinners, so why does she bruise easily? Now, anemia has been a concern for her in the past. She had some previous lab results. She has a macrocytic anemia in the past. Now, macrocytic means the red blood cells are getting big. That's not microcytic, we're talking macrocytic. And macrocytic is usually due to a problem with not enough B12 or not enough folic acid, whereas microcytic, getting small, is usually a problem with iron. She's vegan but not gluten-free. Now, immediately, someone who's vegan, I'm not having nothing against people who are vegans. I was a vegetarian for a decade. If you're vegan, you're automatically at risk for iron deficiency, B12 deficiency, folic acid deficiency, unless you supplement and unless you can actually absorb those things. Now, she also has, we talked about this digestive discomfort a minute ago, she has lower abdominal pain and bloating relieved by passing stool gas. So she's clearly getting gas production from something. She could be over-fermenting. That could be an inflammatory response. We don't know yet. But this happens several hours after eating. So anatomically, probably not her stomach, probably not her small intestine, probably more like something going on in the large intestine. She does have constipation. She does get irritable and lightheaded if she misses a meal. And that's what I was talking about when I said with her fatigue was kind of indicative of a HPA problem. Well, people who can't go 3 or 4 hours without eating, or they start to feel bad or start to be irritable, lightheaded, what that means is the kind of blood glucose stability circuit, which really is your HPA circuit, is not working very well. I don't really have time to kind of get into the physiology of that, except to say that this right here is telling me that we have a problem with the HPA axis, and her fatigue may be more related to this, or it could be multiple things working together to cause her to have the fatigue. Eating relieves the fatigue, which again tells you that her glucose is too low, and so when she eats, her glucose goes up and she feels better. So something is going on with her ability to maintain her glucose levels between eating. And the thing that should do that is a normally functioning hypothalamus pituitary adrenal circuit. So hers is not doing that. All right, she depends on coffee to get started and keep going. Same thing with the HPA axis. She has afternoon fatigue and headaches. You see that a lot in people that have these HPA problems. Lightheaded when standing up too quickly, that could be orthostatic hypotension. Again, that could be this HPA axis. So she's taking the valcyclovir, the levothyroxine, some quote-unquote thyroid supplement, which always worries me because I don't know what's in it. Iron, okay. B12 and D3, great, okay. And she's using a CBD oil tincture, and she's taking collagen. Now, people that have autoimmune problems very often do not want to be taking collagen because they may have collagen antibodies, so we'll see. So this is her labs, her pre-treatment labs. You can see right here that her MCV is 98. That's high. That's macrocytic. And again, she's not anemic by the lab ranges there, but something's going on with the size of her red blood cells. Maybe that's just her and that's really normal for her, but it does make us wonder. Her D is a 33, which really is not good for someone with Hashimoto's because we know that she's taking vitamin D. Her vitamin D should really be a lot higher than 33. And we can see there that her thyroglobulin antibodies are still quite high. I mean, they're quite high. Now, given her previous, I'll just go let you guys in on something. Given her previous history of thyroid cancer, it does make me kind of go, because you can develop really high thyroglobulin antibodies if you have thyroid cancer. These aren't really to the threshold that would really worry me about that, but I did talk to her about it. Magnesium isn't where I'd like it to be. That might have something to do with her anxiety, because magnesium essentially acts like a brake pedal in the central nervous system. Her ferritin, again, 36 is not good. I know you can see that it says it's normal there in the range, but she should not be anywhere close to that. She's taking iron. She needs to be at least 50, at least 50. She's probably having some fatigue just to that, because ferritin is your best indicator of iron. It reflects 22% of your body's iron. And of course, you see her TPO antibodies are not 0, but they're not, they're not above the range. But she's essentially euthyroid. So what do we know? Well, we got Hashimoto's primarily because of the thyroglobulin antibodies, and her ferritin's too low. Okay, magnesium's too low. All right. Vitamin D is too low, right? And even though she's taking the iron and the vitamin D, it makes me wonder about this absorption thing with her. And if you guys have watched my channel before, anytime someone's taking something and their levels aren't great, and we're wondering about absorption, we start thinking about malabsorption, right? Is there something going on with stomach acid production or something going on in the small intestine? And so let's see what we find out. Now, with her multiple tissue autoimmune panel, we already know, if you can see at the bottom, we already know we expected to see thyroglobulin there because, we already know about that. But these two guys here at the top, we got to talk about this. So alpha-myosin, that is the primary protein in heart muscle. Now, it doesn't mean she has a heart problem, but you do find elevated antibodies in people that have what's called like dilated cardiomyopathy, another sort of autoimmune heart disease. But she doesn't have any symptoms at all of heart disease. But I will tell you that there's a food that cross-reacts with alpha-myosin, and that is gluten. Okay? Now, phospholipid, that's another thing I'm not super, I don't love that, because phospholipid antibodies, if you can have a full-blown what's called anti-phospholipid syndrome, which can really make you have be a bleeding risk, could make you have low platelets, could make you be easy bruising. So those I don't like. Of all the antibodies you guys have heard me talk about, the one I like the least are phospholipid antibodies, because they really are a bleeding risk. They can. Now, maybe her easy bruising is an early manifestation of that, but the other thing I want you guys to remember is that antibodies like these have a predictive power. Sometimes these antibodies are there 5, 7, 10 years before the person has overt autoimmune disease that matches up symptom-wise and findings with these antibodies. The point is, she's got multi-autoimmunity happening, right? And we know again that she's got thyroglobulin, and by this lab, which uses a slightly different method than LabCorp, her thyroid peroxidase antibodies are slightly elevated as well. So she has multi-autoimmunity. Her autoimmune problem has expanded. And she is probably eating, in fact, I know she is, cross-reactive foods, meaning foods that when she eats them have a really high chance of making these antibodies worse. And I won't go through all those right now. You can look up my other videos on different cross-reactors. But there's foods that cross-react with alpha-myosin, foods that cross-react with TPO. No foods that we know cross-react with thyroglobulin itself. But she is eating things that are very likely making this worse. And that's one of the reasons why we run this panel. Now, her lymphocyte map, I'll kind of breeze through this. You can see her T cells are on the high end, the B cells are on the low end, so the ratio, her T cells are a little bit high, a little bit dysregulated in terms of balance. If you look at the T helper 1 and T helper 2, the T helper 1 is high, the T helper 2 is slightly high, so we definitely have, her immune system is sort of pumped up, right? It's kind of on alert, and then her Th17 is high, but what you don't see is you do not see her regulatory T cells also being high as a compensation, which would be normal, we would expect. So therapeutically, see, I wouldn't know this if I hadn't run this test. This lymphocyte immunophenotyping test tells me her regulatory T cells could probably use a boost, and her T cells could probably need to be therapeutically decreased. Th1 and Th2 probably also need to be dampened a little bit. And that's the benefit of this test, is it's an immune system fingerprint. Because if you don't do the test, you don't know, like her symptoms can't tell me that that's what that looks like, right? So anyway, so we know the TB is abnormal, we know the Th1 and Th2 are too high, we know the Th17 is high, but there's not a regulatory T cell compensation like there should be, okay? Now, what's the treatment plan? Well, the treatment plan is going to be, she can't do that optimal form of the short-term anti-inflammatory diet because of her veganism. So we settled on just having her avoid foods that we know cross-react with those elevated antibodies I pointed out. And that's, again, one of the advantages of doing that test is knowing what foods cross-react. You don't have to waste your time doing an IgG food sensitivity test, which are a waste of time. We just kind of do that in reverse. We also are going to put her on an anti-inflammatory supplement protocol. And again, I'm not going to tell you exactly what we did because what we did for her is not exactly what we do for you. And I just don't want you guys out trying to self-treat. We are going to support her HPA Axis tone, and we're going to do that using some adaptogen formulas. And so what happens? Well, after 30 days of this lady who's had Hashimoto's, the fatigue, the brain fog, the chronic pain, here's what she reports. She says her fatigue is about 50% improved, which is wonderful. She says there's only been 1 or 2 days when she felt deeply fatigued. Well, whereas, every day of the week she was having these really deep fatigue, right? She couldn't go very long without eating. She was crashing in the afternoon. Her brain fog is also about 50% better. Now, that may mean the brain fog is directly related to her glucose stability. We don't know yet. I always ask people, well, how do you know, right? Well, she said she was able to write while she was on vacation. She had thought maybe, she wouldn't be able to do any type of creative writing anymore, but she was able to do it and it didn't fatigue her and she had the energy to do it and the brain power to do it. So that's a wonderful thing, right? This thing that you enjoyed that you thought was gone, now you have it back. Less days of severe pain, about 60% better with digestive discomfort. So either there's foods we're eliminating that are making that better and or the de-inflaming plus removing the foods is doing the job because her abdominal pain has significantly decreased and there's less bloating, which is wonderful. Now, what do? Well, the treatment plan is going to be, hey, keep avoiding those foods that cross-react with those elevated antibodies, and you're going to need to avoid those for quite a while. We're going to make sure we're replenishing the iron, which I forgot to put on the past thing. We're going to keep doing the anti-inflammatory protocol. We're going to support that HPA Axis tone because I don't know if she's done yet. I mean, I think she's still got some improvement yet to do, right? In about 3.5 weeks, we're going to recheck D, ferritin, and those thyroglobulin antibodies. All right, so 60 days into treatment, we get the labs back. She emailed saying, you know what, I've had a couple days of loose stools and diarrhea. And at that time, I'd recommended that she consult her GP about it. She said that she probably was a little hyperthyroid because in the past when she's been hyperthyroid or slightly over-medicated, it gives her these palpitations, gives her these kind of loose stools. So on her own, she kind of adjusted her dosage and symptoms were fine. So essentially, she was taking a little too much thyroid medication, and that's what happened with that. Now, she also noted that in the last 10 days, she hadn't been taking her supplements because of these GI symptoms. So we waited a little bit and we did her recheck of her blood chemistry, which showed TSH looking great. The vitamin D's come up a little bit, not as good as I'd like, but it's still coming up. And look at this though, her thyroglobulin antibodies have dropped, 131 points, which is good. That's excellent. That makes me very happy. And her ferritin has come up 14 points. So we now know that she must be absorbing the vitamin D and the iron better. We know that she is euthyroid because her TSH is looking good. And we know that those antibodies are coming down, so we must be doing a pretty good job. So what do we do now? Well, treatment plan is we resume that previous protocol we outlined 2 months ago, including the diet, because remember she'd been off of it for about 10 days. We're going to follow up in about 30 days. And 3 months into it, right, 90 days, fatigue, brain fog, pain, all remained improved over baseline. Still all those big chunk of improvements, those have been maintained. She did dine out at an Indian restaurant and mistakenly ate some papadum, which is made from lentils, which was something she was supposed to be avoiding due to cross-reaction, and it caused severe bloating. Severe bloating. So we know that some of the foods that she was eating were a problem for her. Digestion is still better than baseline, but she's still having constipation and occasional morning diarrhea, so that's a work in progress. We're not done with that. So what do we do now? Well, we're going to keep avoiding those foods. We're going to replenish the iron, keep her on the anti-inflammatory protocol, support the HPA Axis tone. This should be a different bullet here, but add a probiotic formula to see if I can help with the constipation diarrhea. And we're going to follow up in 30 days, right? So if we think about it, this is still a work in progress, but we're 90 days into it, and her brain fog, so far, the fatigue is significantly better and stable, right? Her brain fog is significantly better and stable. The chronic pain is significantly better and stable. Her antibodies are down. Her iron and vitamin D are up. So we know we are definitely on the right path. Now, I show you this case today to let you know you don't have to settle, right? But you got to make sure that your doctor, A, knows what test to order, how to interpret them, how to treat what they find, how to find out if something's working or not working. But you've got to find someone who understands all that stuff we just talked about, right? You got to understand that, having Hashimoto's and taking Synthroid is not like, the end. That's the beginning. If you're still having symptoms, you've got to work through the possibilities, find out what things are working, what things aren't working. So you're going to have to dig a little bit, but make sure you're working with someone that understands about, the multiple tissue autoimmune testing and the lymphocyte map and understands all the physiology and how to break down symptoms and how to analyze them. But just remember, again, you don't have to settle. You just got to look a little bit harder until you find someone who knows these things that we've talked about today. All right, so I hope you found today's case helpful, and I'll see you later.